This is Healthline on Lagos Talks 91.3. Once again, I am Olaoluwa Awe, the news lady, and today we want to talk about the most common sexually transmitted diseases in the world. I'm going to talk about the most common ones in the world. I will talk about the most common ones in Nigeria according to data from different, health organizations. And we do know that sexually transmitted diseases are infections that are spread from one person to another, typically during vagina, anal, or oral sex. And in 2018, there were about 26 million new reported STD cases, in countries like the United States, according to the Center for Disease Control and Prevention, the CDC, that's in the US. And while that number may already seem quite high as at that point in time, it kept getting higher and higher since the majority of STDs don't present with symptoms. And this means that many people who have an infection may not even know they have it, and they might unwittingly spread it to others. So there are a number of sexually transmitted diseases spreading all across the world. But then, which ones are the most common? And that's what I'll be talking about today. So welcome once again. This is Healthline on Lagos Talks 91.3. Now, I'm going to do top 3 from all around the world. Then I'm going to do maybe another top 6 thereabouts in Nigeria. So according to available data, number 3 on my list today is gonorrhea. Now, gonorrhea is the third most common STD and the second most reported one. And gonorrhea is a bacterial infection that can be successfully treated with antibiotics. That's the good thing about it, though. It is treatable because it is a bacterial infection. And the bad thing about it is that if you delay treatment when it comes to gonorrhea, it can lead to medical complications. And like chlamydia, some other sexually transmitted infection, untreated gonorrhea can result in what is called a pelvic inflammatory disease. That is in women. It's called PID, a pelvic inflammatory disease in women. And it can also increase one's risk of contracting the HIV. So most gonorrhea cases don't present with symptoms. That's the funny thing about this particular disease. But some of the most common signs of the infections I will be talking about as well. One thing you might look out for if you want to know if, some of the symptoms, is painful urination. This is something that most people have reported. If you're beginning to urinate and it's really painful, maybe you should go to the doctor and do a test. Do an STD test so that they can know exactly what is going on there, because it is one of the, most common symptoms of gonorrhea. Another one is abnormal discharge from the genitals. And when I talk about abnormal discharge from the genitals, I mean both men and women. Male and female. Painful urination as well, both male and female. It is not gender based. These symptoms. So if you discover that you're beginning to get discharges that are really not normal, then of course you should go for a test. But in women, one major symptom in women who have gonorrhea is bleeding between periods. And that's why as a woman, once you begin to get like a regular period, it is advised that you go see a doctor, go to the hospital and get yourself checked so that they can examine you and know exactly what is going on down there. Because for most women, the menstrual cycle is usually like predictable. It has a pattern. But, when you know that, maybe you see your period like after 24 days or 28 days. But then in between, after 1 or 2 weeks, you're seeing your period again. That's what we call like bleeding in between period. And when we mean bleeding, it could be spottings. Spotting is not really like a full-fledged like period. It could be, period as well. But just go on and get tested. Then in men, one symptom that has been reported in men who have gonorrhea is what is called swollen testicles. And I know the men know what I'm talking about. When there's an inflammation or a swell, down there, then you know that there's something wrong. and we definitely need to get checked. And the other funny thing about this disease is that a mother can pass on gonorrhea to her baby during childbirth. Do you even know that? Yeah. That's why medical professionals encourage pregnant women to go for STD testing before birth and ensure that everything is down there before they give birth, because you can really expose your child to that particular disease. And let me talk now, or move on now to the second most spread disease, sexually transmitted disease in the world, and that is chlamydia. Do you even know what chlamydia is? It's the most reported STD, which is an STD that must be reported to local health departments when diagnosed. You have to report it. It's also a bacterial infection, and it can be cured with a round of antibiotics as well. But then untreated chlamydia can cause serious health complications for women. The infection can spread to the uterus, the fallopian tubes, and lead to pelvic inflammatory disease. And this condition can result in permanent damage to the reproductive system. It can also lead to infertility in women as well. So the early stage of this disease usually comes with no sign or symptoms. So it makes chlamydia very, very difficult to detect. And when they do happen, when the symptoms do come, it takes about 1 to 3 weeks after you've been exposed to chlamydia, for the signs to come. The signs and symptoms may seem to even be mild and passing, and it makes it very, very easy to overlook. And that's why you see that when you have some of those STDs that are very difficult to diagnose or to even notice in the body, it's easy for you to spread them, and that's why they are top on my list. They are very subtle. Chlamydia is it can be very subtle, and it's easy for you to just dismiss it and go on having, sex with people all around, just spreading it all around. You can imagine that it doesn't sound good at all. So it is very important that some of the symptoms are also checked. But what are the symptoms? As I mentioned, not everyone with chlamydia will have the symptoms, but those who do may experience painful urination as well. And you see the relationship between chlamydia and gonorrhea. Sometimes when you have, and that's why it's important that you don't just self-medicate, because when you see some of the symptoms, you could think it's for gonorrhea, whereas it is for chlamydia. Because painful urination is also like a symptom. Another one is pain during sex. That's a given for chlamydia. Abdominal pain is also another major one to look out for there. Rectal pain, discharge, or bleeding. And what do when we mean rectal pain? Pain around your backside. When you are trying to do the do. Relieve yourself, of feces and all of that. Also, if it's coming with discharge, when you're trying to poo, you can see blood. If you feel pain around that side of your body, then you should quickly go to the hospital and get yourself checked. Then another major one for chlamydia, symptom is abnormal discharge from the genitals. The thing is that generally abnormal discharge from the genitals could be a sign of different types of STDs. So it is very important to get checked so that you know exactly the way to go about it. And the best way to prevent chlamydia is to engage in safe sex by always using, contraceptives, condoms, to get regular. When you use condom, you prevent this disease from spreading, and you also need to get regular STD testing if you're sexually active, especially if you're not in a monogamous relationship with a disease-free partner. And this is very important. I feel like even if you're in a monogamous relationship, you think you trust your partner, you're not seeing other people, your partner is not seeing other people, you still need to get tested from time to time, because you never really can tell what people do with your time and energy. And